You are putting America's babies' health at risk, America's seniors' health at risk, all Americans' health at risk, and you should resign.
This explosive exchange reveals a major shift in vaccine policy.
Thank you, Mr. Chairman. So, last November, while you were under consideration to become Secretary of Health and Human Services, Mr. Kennedy, you said, quote, if vaccines are working for somebody, I'm not going to take them away. No exceptions, no ifs, ands, or buts. You would not take away vaccines from anyone who wanted them. Then last week, you announced that the COVID-19 vaccine is no longer approved for healthy people under the age of 65. In announcing the change, you said the vaccine will be available for anyone who wants it. Now, obviously, both things cannot be true at the same moment. So let's clear this up right now, Secretary Kennedy. Will you tell America that all adults and all children over 6 months of age are eligible to get a COVID booster at their local pharmacy today?
Anybody can get the booster.
I'm sorry?
Anybody can get it, Senator.
Anybody. So you're saying that is now the official rule of HHS. Anybody is eligible to get a booster by just walking into the pharmacy.
It's not recommended for healthy people.
No. If you don't recommend, then the consequence of that in many states is that you can't walk into a pharmacy and get one. It means insurance companies don't have to cover the $200 or so cost. As Senator Dr. Cassidy said, you are effectively denying people vaccines.
We're not going to recommend a product for which there's no clinical data for that indication. Is that what I should be doing?
What you should be doing is honoring your promise that you made when you were looking to get confirmed in this job.
You're going like this.
And that is, you promised that you would not take away vaccines from anyone who wanted them. You just changed the classification of the COVID vaccine.
I'm not taking them away from people, Senator.
It takes it away if you can't get it from your pharmacist.
Well, most Americans are going to be able to get it from their pharmacy for free. Most Americans will be able to get it from their pharmacy for free.
The question is everyone who wants it. That was your promise.
I know I didn't. I never promised that I was going to recommend products with which there is no indication.
When you said,
and I know you've taken $855,000 from pharmaceutical companies, Senator.
Did you hold up a big sign saying that you were lying when you said that? Because you are the one who said you would not take them away. Now, Senator Kennedy,
I'm not taking them away from anybody.
Secretary,
you want me to indicate a product for which there is no clinical data?
Senator,
is that what you want?
Secretary Kennedy, you said you wouldn't, and now you did.
I'm not taking them away. Everybody can get access to them.
No, they can't walk into a pharmacy the way they could last month and get access.
It depends on the state. It depends on the states.
A year ago,
but they can still get it. Everybody can get it. Everybody can get it, Senator.
So look, let's move on. You clearly are taking away vaccines. I've seen the list for what's coming up next, and that is the agenda for the next CDC vaccine panel. And first up is ratifying your COVID actions. Second is hepatitis B is on the agenda. So should Americans expect you to take away hepatitis vaccine access as well, even though you promised not to?
As I said, I'm not taking vaccines away from anybody.
Okay, same answer, right? You're just going to deny that when people can't get access, that you're not taking it away. Then let me ask you, is that the same game you're going to play with measles,
you want me to recommend every product in the world?
No,
so that without any clinical trial data.
Through on your promises.
Yeah, my promise was to give.
A month ago, we could get COVID vaccines by just walking.
You can still get COVID vaccines, Senator.
You are taking that away.
No, you are still. You can still get the COVID vaccines, and Medicare will still pay for them, and Medicaid will still pay for them.
Tell the head of the CDC that if she refused to sign off on your changes to the childhood vaccine schedule, that she had to resign.
No, I told her that she had to resign because I asked her, are you a trustworthy person? And she said no. So if you had an employee who told you they weren't trustworthy, would you ask them to resign, Senator?
So I'm sorry, but this is not what she has said publicly. She has said
I'm not surprised about that.
So you're saying she's lying?
Yes. Every conversation I had with her, there were witnesses.
Let me get this straight. This is the same person that less than a month earlier, you stood next to her and described her as unimpeachable and you had full confidence in her, and that you had full confidence in her scientific credentials. And in a month, she became a liar?
Yeah, you should ask her what changed. And by the way, a month ago, you were voting against her. Oh, because you thought she was either incompetent, ineligible, or unsuited to the task.
I voted against her because I was afraid she was going to bend the knee to you and Donald Trump. And it looks like she didn't bend the knee, so you fired her. Look, you are putting America's babies' health at risk, America's seniors' health at risk, all Americans' health at risk, and you should resign.
At the center of the dispute is a tension that often comes up in public health policy, the difference between something being available and something being officially recommended. On paper, those two ideas can sound similar, but in reality, they shape access in very different ways. When a health authority recommends a vaccine broadly, it doesn't just signal approval of the science behind it. It also influences how pharmacies stock it, how insurance companies cover it, and how easily an average person can walk in and receive it without additional barriers. The line of questioning in the exchange is focused on that exact gap. One side is pointing to earlier statements suggesting that vaccines would not be taken away from people who want them. The concern being raised is that even if a vaccine is technically not banned, changing its recommendation status for certain groups could still reduce real-world access. That's because once a vaccine is no longer routinely recommended for a population, it can shift into a different regulatory and financial category. Pharmacies may become less likely to carry it widely, insurers may stop covering it in full, and patients may face out-of-pocket costs that weren't there before. That's why the argument quickly moves from policy language into practical consequences. The question being pressed is whether an available for anyone who wants it standard still holds true if the system around it no longer supports easy access. The response from the health official in the exchange emphasizes a different concern, that recommendations should be based on clinical evidence for specific groups, and that recommending a medical product without strong data for that particular use would not be appropriate from a regulatory standpoint. This is where the debate becomes less about intention and more about interpretation. One perspective focuses on preserving unrestricted access if an individual chooses it. The other focuses on ensuring that official recommendations are tightly aligned with the evidence base, especially when it comes to public trust in health institutions. Both positions are tied to long-standing debates in medicine: autonomy versus evidence-based guidance, access versus targeted recommendation, and how governments balance individual choice with population-level data.